Hello, Shivantika.
Hello, ma'am.
ശരിയാണല്ലോ.
മാം അപ്പം പൈരമുത്തേട്ടനാണോ വോട്ട് ഓഫ് താങ്ക്സ്? ഓക്കെ, അപ്പൊ ഞാൻ ചേഞ്ച് ചെയ്യട്ടെ മാം. ഹലോ മാം.
ഒരു മിനിറ്റ്.
ഓക്കെ മാം.
ഹലോ
മാം, സ്ക്രിപ്റ്റിൽ ചേഞ്ച് ചെയ്യട്ടെ മാം.
ഏതാ
സ്ക്രിപ്റ്റിൽ ചേഞ്ച് ചെയ്യട്ടെ മാം.
ചേഞ്ച് ചെയ്തോ മാറിപ്പോണ്ട.
ഓക്കെ മാം.
എനിക്ക് ആവശ്യമുണ്ട്. രോഹിത് വിളിച്ചിട്ടുണ്ടായിരുന്നു.
ഷീലു.
എന്താ ഓക്കെ അല്ലേ? വേറെ ഒന്നും ഇല്ലല്ലോ. വേണ്ട. അപ്പൊ സാർ സംസാരിക്കും ചിലപ്പം. ഇൻ കേസ് സാറിന് നെറ്റ്വർക്ക് ഇഷ്യൂസ് ഉണ്ടെന്ന് പറഞ്ഞു. മഴയാണ് അവിടെ.
ഓക്കെ മാം. അപ്പം ഞങ്ങള് ദീക്ഷ ടീം കറക്റ്റ് ആയിട്ട് അഡ്മിറ്റ് ചെയ്യില്ലേ മാം?
എങ്ങനെ?
ഞങ്ങളിത് വായിച്ചാ പോരെ മാം? അവര് പറയില്ല, കുഴപ്പമൊന്നുമില്ലല്ലോ മാം?
ഇല്ല
സ്ക്രിപ്റ്റ് വായിച്ചാ പോരെ മാം?
അതിലെ പോലെ വായിച്ചാ മതി. സാറിനായിട്ട് വിളിക്കണ്ട. സാർ ഇൻ കേസ് സംസാരിക്കുന്നതിന്റെ ഇടയിൽ സംസാരിച്ചോളും. സാറിന് ആ സമയത്ത് നെറ്റ്വർക്ക് ഉണ്ടെങ്കിൽ നിങ്ങൾ ഇൻവൈറ്റ് ചെയ്യേണ്ട ആവശ്യമില്ല.
ഓക്കെ മാം. ക്വസ്റ്റ്യൻ ആൻഡ് ആൻസർ കഴിഞ്ഞ് സാറ് ഉണ്ടെങ്കിൽ സംസാരിച്ചോളൂ അല്ലേ മാം?
സാർ അല്ല, അങ്ങനെ അല്ല, മീൻസ് മോസ്റ്റ്ലി കോ-ഹോസ്റ്റ് ആക്കില്ല.
ഓക്കെ.
അപ്പം നിങ്ങൾ വരുമ്പോൾ തന്നെ വെൽക്കം അഡ്രസ്സിനായിട്ട് തന്നെ വോട്ട് ഓഫ് താങ്ക്സ് ആയിട്ട് തന്നെ വിളിച്ചാൽ മതി.
ഓക്കെ. അപ്പോ മിസ്റ്റർ വൈരമുത്തു അങ്ങനെ എന്തെങ്കിലും വേണോ മാം?
നല്ലല്ലേ?
ശ്രീ അറിയില്ല, ഇനീഷ്യൽ പോലും അറിയില്ല ഏട്ടന്റെ.
അയ്യോ, വൈരമുത്തിന്റെ ഇനീഷ്യൽ എന്താ അറിയണല്ലോ. ജസ്റ്റ് ഞാനിപ്പോ അത് റെഡി ആക്കി തരാം.
ഓക്കെ മാം.
വാട്സപ്പ് ചെയ്യാം.
ഓക്കെ മാം.
സാർ എന്താ ജോയിൻ ആവത്തെ? തുല്യ മാം വന്നല്ലോ. മാം
പറഞ്ഞിരുന്നു സാറിനോട്, ഓർമ്മിപ്പിച്ചിരുന്നു.
അതെല്ലേ?
4:45 ഞാൻ ജോയിൻ ചെയ്തോളാന്ന് പറഞ്ഞു സാറ്. എന്തായാവോ?
നാട്ടില് മഴയാണെന്ന് തോന്നുന്നു. നല്ല അടിയല്ലേ?
വിളിച്ചു നോക്കാം.
വന്നു സാർ വന്നു.
ശരി.
Hello, sir. Sir.
Hello, good evening, sir. Echo, sir. Hello. Sir.
തോന്നുന്നു.
Hello. ഇതാ
ഓഡിയോ ജോയിൻ ചെയ്തിട്ടില്ല തോന്നുന്നു സാറിന്റെ.
ഓഡിയോ ജോയിൻ ചെയ്തല്ലോ. ഹലോ. 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 ഹലോ, കേൾക്കാമോ?
ആ സാർ പറയുന്നത് കേൾക്കുന്നുണ്ട്. പക്ഷെ ചാക്കോ സാറിന്റെ മൈക്ക് സിമ്പൽ കാണിക്കുന്നില്ലല്ലോ സാർ.
ഇല്ലേ?
ഓഡിയോ
ആറില്ലേ? ആണോ? സാറ് ഉണ്ട്. സാറിനെ ഞാൻ വിളിക്കാം. ഹലോ. സാറ് ബിസി ആയിരുന്നു. ഹലോ. സാറിന്റെ ഓഡിയോ വന്നിട്ടേ ഇല്ല.
Sir.
Good evening, sir.
Good evening, sir.
ഹലോ സർ, കേൾക്കാൻ പറ്റുന്നുണ്ടോ സർ? സർ ഗുഡ് ഈവനിങ് സർ.
Good evening, sir.
ഹലോ. ഹലോ. ഇതാ
ഹലോ സർ. സർ കേൾക്കാൻ പറ്റുന്നുണ്ടോ സർ? ഹലോ സർ. സാർ കിട്ടുന്നില്ലെങ്കിൽ സാർ ഒന്ന് റീജോയിൻ ചെയ്ത് നോക്കൂ സാർ. ഹലോ സർ. ഗുഡ് ഈവനിങ് സർ.
Hello, sir.
ഹലോ സർ, മ്യൂട്ട് ചെയ്തിട്ടാണല്ലോ സർ. ചാക്കോ സർ, സാറിന്റെ ഓഡിയോ ഒന്ന് സാർ ഒന്ന് റീലോഗിൻ ചെയ്യോ സർ?
മാം സാറിന്റെ ഓഡിയോ കണക്റ്റഡ് അല്ല മാം. സാർ കേൾക്കുന്നുണ്ടാവില്ല.
ശ്രീലക്ഷ്മി,
Ma'am.
ഹലോ
Ma'am, പറയൂ ma'am.
മാം സാറിന്റെ ഓഡിയോ കണക്റ്റഡ് അല്ല മാം. സാർക്കൊന്നും കേൾക്കുന്നുണ്ടാവില്ല. There is some technical issue. Please stand by. Sorry for the inconvenience.
Hello, Sri Lakshmi. Am I audible now? Hello.
Yes, sir.
Yes,
Yes,
sir.
Okay, right. Now Chako sir audio available. Now welcome.
Hello.
Hello.
Ah,
Yes.
Hello. Good evening, sir.
Good
Hello,
evening.
കേൾക്കുന്നുണ്ടോ?
sir.
കേൾക്കണ്ട്
It is
sir.
audible now. Yes,
Yes,
yes.
sir.
എനിക്ക് പക്ഷേ നിങ്ങളെ കാണാനില്ല. ഇപ്പൊ കാണുന്നു.
Yes, yes. Okay, sir. സാറിന്റെ വീഡിയോ
വീഡിയോ ഓൺ ആണോ?
അല്ല sir.
സ്റ്റാർട്ട് വീഡിയോ.
Yes, sir.
Yes, yes, yes.
Yes, sir.
പക്ഷെ അത് കഴിയുമ്പോ ശ്രീ വെയിറ്റിംഗ് റൂം എന്ന് പറഞ്ഞിട്ട് ഒരു ഇതാണല്ലോ തന്നെ.
അത് സാർ നോട്ടിഫിക്കേഷൻ വരുന്നതാണ് സാർ.
അപ്പൊ
ജോയിൻ ആവുന്ന ആൾക്കാരുടെ അത്
അത്
അത് സ്ക്രീനിൽ ജസ്റ്റ് വേറെ താഴെ ടച്ച് ചെയ്താൽ മതി സാർ. എന്നിട്ട് വീഡിയോ ജോയിൻ ചെയ്തോളൂ.
ആ വീഡിയോ ഇപ്പൊ ഓൾറെഡി ഓൺ ആണ്.
Okay, sir.
ഓക്കെ സാർ. കാണുന്നുണ്ട് സാർ.
കാണുന്നുണ്ടോ?
സാർ
Yes, sir.
കാണുന്നുണ്ട്.
കാണുന്നുണ്ട്.
ആണുണ്ട് sir.
പക്ഷെ ഇതിങ്ങനെ വന്നോണ്ടിരിക്കുന്നുണ്ട് എന്റെ മുകളിൽ.
അത് സാർ ഇഗ്നോർ ചെയ്തോളൂ സാർ.
അത് അഡ്മിറ്റ് ചെയ്താൽ മതി.
ആ ശരി ശരി.
Shall we start, sir?
ശരിയായോ?
യെസ്
Okay.
സാർ കാണുന്നുണ്ട് സാർ.
ശരിയായി sir.
ശരി,
ശരി
sir.
ശരി. അപ്പൊ ഗുഡ് ഈവനിങ് ടു എവരിബഡി.
ഗുഡ് ഈവനിങ് സാർ.
Okay, sir. Shall we start now, sir?
യെസ് യെസ് വി കൻ സ്റ്റാർട്ട് നൗ.
Okay, sir. Okay, Sri Lakshmi.
ഓക്കെ സാർ.
Happy to join all of you again after a few months. So I'm very happy to give a small introduction to Kamar Vritya. And because it's a very vast subject, that is diseases and their treatment, it will take some time. So is there any introduction or anything like that?
Yeah,
Yes,
it is
sir.
there, sir.
We have
Yes,
introduction, sir.
Okay,
sir.
then you can go ahead with that.
Okay, sir.
Thank you, sir.
You can start now. Shiva.
Yes, sir. Good evening, everyone. The word meaning of Samsiddhi itself is complete knowledge. Samsiddhi is one of the greatest platforms for all great minds of Ayurveda coming together, where one can harness the in-depth knowledge of Ayurveda. Samsiddhi will envisage to develop a new dynamics in realm of Ayurveda. Today is the 11th day of Samsiddhi National Web Conference 2020, conducted by Ayurveda College, Coimbatore, and powered by DIKSHA e-learning. Let us start the session with the blessings of God.
Answer കാണുന്നുണ്ടോ?
Om Namami Dhanvantarim Adidevam Surasure Bandita Padapatmam Loge Jararubhaya Mrityunasham Dadaramesham Vividaushadinam. Now, I invite Dr. Sudhir Raj N., Principal, Ayurveda College, Coimbatore, to greet the gathering. Over to you, sir.
Thank you. A very good evening to all. Welcome to our national webinar series Samsiddhi 2020, conducted by Ayurveda College, Coimbatore, and powered by DIKSHA e-learning. Thank you all for finding time and joining with us today. Today, we are graced with the presence of great teacher, Dr. P.T. Chako sir, for our session. Sir will be sharing his experience on the topic Common Balaroga and its clinical management. Chako sir is a mentor to our college. In the beginning of our college itself, sir was a teacher here, maybe in 1980s. And after that, he had done his PG from Jamnagar in Kaumarabhrutya, and he worked in various reputed hospitals as a clinician. Later, he joined as a principal in Coimbatore Ayurveda College and retired as Dean of PG Studies. He is a well-wisher of our college. He is a real hero, teacher, and mentor for all the staff and students of Ayurveda College, Coimbatore. With immense pleasure and gratitude, I welcome you, sir.
Thank you.
I welcome all the participants from all over the India and abroad who join with us. Thank you very much. My special thanks to all the faculties and students who had worked hard as a team for making this event a grand success. Thank you very much.
Thank you so much, sir.
Before starting the session, I would like to go through a few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection firstly, and if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions to be raised in the link provided in the chat box. Questions raised in the link will be cleared at the end of the session. Next, I would like to invite Dr. Tulya Mohandas, Vice Principal, Ayurveda College, Coimbatore, to deliver the welcome address. Over to you, ma'am.
Good evening, everyone. I am very happy to welcome Dr. P.T. Chaku, retired Dean and former Principal of our college, to Samsiddhi 2020. Chaku sir is a good administrator, practitioner, and a good teacher who guides and supports everyone when needed. We are all blessed, sir, to be here to share his knowledge and enlighten everyone on topic common Balarogas and his clinical management. Again, on behalf of management faculties, students of Ayurveda College, Coimbatore, and all the participants, I extend my warm welcome to you, sir.
Thank you, ma'am. It's a great pleasure for me to introduce our beloved Dr. P.T. Chaku, retired Principal and Dean of Academics, Ayurveda College, Coimbatore. Sir completed UG from Ayurveda College, Kottakkal, and PG in Kaumara Vritya from the Gujarat Ayurveda University, Jamnagar. Formerly, he was Senior Physician in the Ayushman Ayurvedic Trust, General Manager of Technical Section in Ayurveda Pharmacy, Coimbatore, and he is a member of the technical expert team which conducted the first scientific study on Kuti Praveshika Rasayana Chikitsa. He was also a member of the Board of Studies of the Dr. MGR Medical University, Chennai. He started his teaching career from Ayurveda College, Coimbatore, and later was appointed as principal in November 2018 and continued his services even after retirement as Dean of College till 2019. He is a renowned personality in the field of Ayurveda and needs less of an introduction. On a final note, he was the backbone of Ayurveda College, Coimbatore, and was the fatherly figure who made AVC feel like home to all. There was love and wisdom in each word he spoke. Students, faculties, and other members of Ayurveda College, Coimbatore will love and cherish even his rebuke in the most lovable way. Now, I would like to hand over the session to you, sir. Over to you, sir.
Okay, a very good evening to everybody, and thank you for joining me in this webinar. And for giving me a chance, I would like to thank Dr. Sudhir and the entire team, Dr. Tulya and Anand Sai and all the team members. And I would like to start with the subject, that is Kaumar Vritya. In the college days, usually, many of our, even this, in our days also, many people doesn't give much importance to this branch of Ayurveda. Because it was only a small part of the Prasudi and Kaumarvati. Always it was together, and only a small portion was being taught in the colleges. And now only after the CCM syllabus and everything came, more importance was given to Kaumarvati, and after starting the PG in Kaumarvati in BHU as well as Jamnagar and Trivandrum, a few of my students also have gone for PG, even my friends and my seniors, they have also undergone the PG in Kaumar Vritya. I would like to start with a small introduction about Kaumar Vritya. As all of you know that it is the most important branch of all the Ashtangas of Ayurveda, and is one among the 8 branches of Ayurveda. In the context of Vajigarana, it is said that a person without progeny is like a tree without branches and fruits, serving no purpose and its existence. Achaya Pudi Kusuma Bhalena Rehidodruma Yata Egascha Nirabatyas Tadanara. But if the branches are lame or the fruits are bitter, the tree would still be looked down upon by the society. So it is not merely giving birth to a progeny that matters. Rather, more important is that the progeny should be capable, both mentally as well as physically, to an active participant, to be an active participant of the society. For this fact that today's children are the future of the family as well as the nation tomorrow. Importance of Kamarbhatya is children being the building blocks of the nation as well as the most vulnerable group of the community required to be handled with utmost care and concern. Hence, pediatrics, the branch of medical science dealing with their health and disease, is indeed of special significance. Kaumarvrityam Ashtanam Tandranam Adyam Uchide Ayurvedasya Mahado Devanam Iba Evgaba. That is Kashipa Samhita in Vimanasthana. Kashipa told that it is the most important branch of Ayurveda. Acharya Sushruta defines Kaumarvritya as Kaumarvrityam Nama Kumarabharana Dhatri Kshira Dosha Samshodhanartham Dushtasthanya Graha Samuthanam Javyadhinam Upasamanartham. That is in Sushruta Sutra he has mentioned. And the health problems of children are different from those of the adults because of the following reason. As all of you know, because of their Saugumaryada, that is, children are highly vulnerable due to Sugumaratva. Their body is very tender and soft. And Alpakayada, lower body mass index in comparison with the adults. And Sarva Anna Uvasevada, that is, children cannot consume all types of food. Abadivakva dhadu, that is, immature dhadus. And dosha dushya mana alpada. Qualitatively and quantitatively, doshas and dushyas are less in their body. Asamatva agada prana dosha dhadu mala aujasa. Equilibrium of functional and structural entities of children is unstable. Ajada Vyanjanam, children have not developed their secondary sexual characters. And Ahara Sankarat Aniyada Vanni, that is, status of Agni in children is unstable. And they are not acclimatized with the different states of food material, solid, liquid, semi-solids, etc. And Madhura Satmyam. Children are more fond of Madhura Rasa and it yields better health in them. Vak Cheshtayor Asamarthyam. That is, children cannot properly express their needs through language and action. Now coming to, because always in our clinical practice, we usually confront with a very emergency situation when the panic patient, that is the parents and the relatives, they come running to a pediatrician to get some relief for their child, because mostly they will not be able to express their discomfort. Emergencies in pediatrics not merely test the experience and judgment of the pediatrician, but also his ability and temperament in coming to a quick decision, because time will be very limited. We have to take quick decisions and administer the medical emergency, attend to the medical emergency very fast. The young patients themselves are hardly expected to volunteer, and they will be only screaming or crying. They will not even listen to what our advice or whatever we are asking them, and cooperate. the patients seldom know the relevant details and are mostly likely to aggravate and try to infect the doctor with their anxieties and fear. The parents who bring the child, they will give a story which may not be completely dependable. And sometimes to get more care and attention from they think that they will get more care and attention from the pediatrician if they exaggerate the condition. So it is because of that they will be exaggerating. So we have to have while taking the judgment, we have to be very careful. No wonder that then that these emergencies offer a lot of detection work. We have to be a very good detective in finding out the actual discomfort of the child. The best person to give the history is the mother of the child or someone who is closely attached to the child or the vet nurse. If the child is old enough to communicate, his information can also be considered. If he is a grown-up child, then we can ask him some leading questions can be asked and he may give some information. And this will help us to arrive at a proper diagnosis. And understanding the the diseases of children, it is a highly specialized work. The clinical presentation of a disease in children is in sharp contrast with that of the adults. Because as we have considered the factors, the main differences between the adults and the children, even among children with a similar dosha dushya constitution, the nature of the disease varies according to the age. For a small baby, it may be different. They will be showing different signs and symptoms, whereas a slightly grown-up child will be showing the symptoms will be, they will not be able to express it, they will be able to express it more clearly. The clinical skill of the physician should be highly competent enough for performing the Trividha Pariksha, that is Darshana, Sparshana and Prashna Pariksha in children as they are with Dosha, Doshya, Mala, Alpada, because all this, it is, as in the beginning I told you, they are all with very tender body tissues as well as Doshya will be, and Mala, everything will be in the very tender stage. And Vak Cheshtayor Asamartyam. And also, Purva Rupa and the Lakshana may be different in different children because the Samprapti is variable in children. Shishos, Tishnam, Adishna, Sarodana, Chaye, Drujam, the severity and lightness of the disease has to be assessed by the cry of the child. Usually, from the cry, we have to make out how severe is the condition or how serious is the condition. Swayam sprushed brisham desam yatraja sparshanakshama tatra vidyad rujam murdinu rujam cha akshi nimilanad. This is mentioned in Ashtanga Hridaya Uttarasthana. That is the difficulty, the disease of the child has to be inferred. Whichever area the body he touches, or while we touch a particular part of the body, the baby shows more signs of agony. We can make out that there is some problem in that part of the body. If the baby closes the eyes, often we should suspect disease is somewhere in the head. Hridi, Jiha Aushta, Dashana, Shwasa, Mushti, Nibhidanehi, Koshte, Vivanda, Vamadu, Tanadvesha, Andhra Kujanehi, Advana, Prashta, Navana, Jataro, Unnamanei Ravi, Vastau, Gukhyejam, Inmutra, Sango, Trasa, Digishanehi. If the baby bites its tongue and lips, it shows breathing difficulty. And clenching of the fist shows that a problem is with the heart. If there is constipation, vomiting, aversion towards breastfeeding, barborigamy or sounds from the stomach, sounds from the intestine, bloating of the abdomen, tries to lift the body from the bed, abnormal body bending, shows pain and abnormality is with the stomach. Constipation, block to normal urination, jittery movements, confused look uh, to different directions shows the problem is with the urinogenital system. Newborns and infants exhibit an amazing capacity to cry, and if there is a cause, it may be even a scream or howl to the agony and concern of not only the parents but also the neighborhood. So when a child is uh, uh, in agony or when he is affected by some disease, he only knows to cry or scream, and this will make the parents and the neighbors in a very pathetic situation. They can only watch the baby cry, so they will be running to the pediatrician to get some relief. Though the amount of crying much depends on the individual, one agrees that this weapon is used really intelligently and quite economically. And this is individualistic. Some people, some children, they will be more able to bear with the condition of the disease. Common causes of diseases of cry in children are hunger or thirst, intestinal colic, intussusception, that is because the intestines may go into the upper part of the intestine, acute otitis media, distension of abdomen, retention of urine, severe upper respiratory tract infection, bronchiolitis, herpetic stomatitis, fall on the head, sprain and fracture of bones of the limbs, poliomyelitis, convulsive tendency, pyelitis, especially in female child, meningitis, peritonitis, fissure in ano, excoriation, itching, dermatitis like scabies, diaper rash, prickly heat, foreign body in the respiratory passage, paroxysmal tachycardia, discomfort from solid linen, wet diapers, and warm and humid environment, insect bite, hyperpyrexia, fever of being left alone or separation from the mother. All these are the causes for a child to be in discomfort, and he only knows to cry to show his reaction towards that. So we have to go into a preliminary investigation to find out the cause of the cry. So the bowel movements and the maturation, a feeding schedule, recent changes in the food, foreign body aspiration, etc., has to be looked into. We have to inquire with the parents or the relatives who have brought the child, whether there is any change in the feeding habit or recent changes in food, or any is there any chance of engulfing or swallowing any foreign body, and a history of a fall. Sometimes without the knowledge of the parents, the baby would have fallen from the bed, and contact with a case of poliomyelitis. Maybe some of their relative child would have been suffering from poliomyelitis, and they would have gone there, and there can be cross infection, and measles, diphtheria, history of infection. We have to go into the detailed history of this infection, ear discharge, if any. We have to look into the ear, past history of retention of urine, pulse rate, temperature, respiration, myocarditis, and paroxysmal tachycardia, hyperpyrexia, bronchitis, pleuritis, infections like herpes zoster, and other painful conditions, traumas, fractures, etc. These conditions will alter pulse rate, temperature, and respiration. Abdominal distension, intestinal colic, obstruction, and peritonitis, perforation of the intestine, appendicitis, acute mesenteric adenitis, colitis, etc., will be the cause of abdominal distension. Examination of the genital organs like penis, vagina, anal region for ulceration or cracks, paraphimosis. In small babies, maybe the prepuce will be sticking, and there can be phimosis and too long prepuce, and perianal abscess, fissures, excoriation of the anal region, and this can also cause pain, and that may be the reason for the child for a squeak. Examine ear and nose and throat, otitis media, diphtheria and tetanus. This condition, and foreign body, if there is anything blocking, because some beads or some small, what you call that, glass balls, or this, the children while playing, sometimes they may put into the ears or nose. Eye and ear trauma, stuffy nose, sinusitis, and the muscle stiffness, especially in poliomyelitis and conditions like that. There can be stiffness of the muscle, tenderness, paralysis, for signs of pre-paralytic and paralytic poliomyelitis and other spinal disorders. Examination on these lines will certainly reveal the cause, and the treatment will differ accordingly. Then if the case is not manageable at our level, it is better to refer the patient to the concerned specialized center. It will avoid unnecessary resentment from the and criticism from the part of the relatives. We should not be overconfident, or it is not a matter of what you call that, self boosting, that just telling the parents that I will manage it. It is better always, if it is not possible to manage with us, to refer to the next specialized center. And some Balarogas and its management. And as you, I think many of our Ayurveda friends know, childhood is divided into various stages. The first stage is Garbhagala, or fetal life. And then comes the Kshirada, that is the infant entirely on milk diet. And Kshira Annada, the infant on milk as well as other solid food items, from 6 months to 2 years. And then comes the Annada, that is mainly on food apart from milk. Solid, mainly the child will be able to take solid food from 2 to 16 years. This period is further divided into Bala, that is a preschool child, that is from 2 to 5 years, and Kumara, a school child between 6 to 16 years. And now, from this, we can see that the classification of children is mostly based on the nature of food taken by the child. Kashyapa says, Garbha, Bala, Kumarakyam, Ityedat, Trividam Vaya, Yevanam, Madhyam, Vriddham, Edatcha, Trividam Guna, Varshavara, Kshirava, Syat, Yavat, Pibadi Vapaya, Vayastad, Balam, Asyacha, Yavat, Shodasha Varshiga, Annada, Sarva Eva Syat, Kaumare, Vayasistida, Adaparam, Dadu, Sattva, Vidya, Parakramehi. This is Kashyapa Samhita describes this. In Ashtanga Hridaya, in Ashtanga Hridaya, Vakpadacharya says, Trividam, Kadido Bala, Kshira Ubhaya Vartana. Vayasas Twa Shodashat Balam, Dhatu Indriya Ojasam Vriddhi, Rasas Tade Madhyam, Asaptade Madhyam, Tatra Vriddhi Paramshaya. So here, up to 16 years, the child is considered to be Bala, and after that, up to 70, it is the Madhyama, and after that, the Chaya, that is Vardhakya comes. And Charaka and Susuda also considers Balya up to 16 years. And pathogenesis in children. Generally, as we see that the doshas will be having their aggravation according to the Vayoho Ratri Bhuktanam, Te Anda Madhya Adi Kramad. It has been clearly described in our text that Vada, Pitta and Kapha dominates during the last, middle, and first or early stages of age. daytime and night in our body. So due to the speciality of age, Balyavastha is a kapha predominant state. Even though kapha predominates, pitta and vata also gets disturbed in the pathogenesis of the disease. Naiga dosha stado roga. So there is no disease which is caused by only one dosha. There will be the other doshas also take part in the manifestation of a disease. The same doshas like vata and pitta and kapha, which produces diseases in an adult person, is also the causative factor of diseases in children also. So the medicines which are used to treat adults are also used to treat the diseases of Bala. Also, only difference is the dosage of the medicine, which has to be adjusted according to the age and the constitution of the body. Taeva dosha doshyascha jvaradya vyadhyasya yel tadastadeva vaishajyam matra tvasya ganiyasi saugumarya alpakayatval sarvan anna anupasevana. Some of the common diseases of the children described in Ayurveda are briefly described here. That pathogenesis, clinical manifestation, course, and prognosis of most of the diseases are not altered significantly today. In this world, 3 persons are always under tension and enjoy and suffer from the spells of happiness and sorrow of the children. They are the baby, the mother, and the pediatrician. A pediatrician has to treat both the mother and the baby simultaneously from the time of conception till he becomes a healthy youngster. In view of the tenderness, dependency, and inability to express, the pediatrician should diagnose in infants and children with the help of all available data and his own observation. He should understand the baby's difficulty and administer appropriate, sweet, soft, light, pleasant, and fragrant medicine in calculated doses. Now, coming to the main problem, which usually is brought to a pediatrician, is allergy. Because in most of the diseases, the causative factor is an allergy. Many children become sensitized to things around them, that is, such as food, drugs, animal hair, dust, pollens, etc. And many show abnormal response to physical agents. Allergy is the term that is applied to this abnormal or altered activity of the cells and tissues. And increased susceptibility is brought about by a previous sensitization. Allergic reactions are the end result of antigen-antibody reaction. Allergy is a subject of great importance because every doctor, whether he is an allopathic, Ayurvedic, or any other system, will encounter allergic manifestation in his practice among children and adults. When we go into the details of the pathogenesis of diseases, we can see that many of the diseases are due to various allergies, starting from jara, kasa, shwasa, skin diseases, eye diseases, and so on. So a pediatrician has to do a thorough study of the Nidana Panchaga by going into a detailed analysis of the Deshavitha Pariksha like Dushyam, Desham, Kala, Balam, Kalam, Analam, Prakriti, Vaya, Tattva, Tatmya, Ahara, and Avastha, which will help us to reach a almost cause of the disease. And there is a important factor is a hereditary predisposition. Many of the diseases are hereditary in nature. In about 60% of the cases, hypersensitivity or allergy, there is a family history of allergy. A child has 25% chance of developing allergies if one parent is allergic. When both parents are allergic, the chances rise to 50 to 70%. Exposure to sensitivity factors by contact like wood, soap, oils, cosmetic, rubber, feathers, etc. By inhalation, that is by pollen, dust, etc. The common inhalants that induce eczema as well as asthma and nasal allergy are house dust on floor, on chairs and beds and mattresses, etc. Wool, feathers, seasonal allergies like pollens of some trees or some plants which is growing nearby, especially this Bangalore and in our area, this Parthenium. When it flowers, many people they get asthmatic attack. Dyes, various types of dyes and synthetic materials, some varnish or polish, paint, smell on garments and animal dust and mites from pets. These are all causes of allergy. By ingestion of food, by milk products, many children are allergic towards milk. That is lactose intolerance will be there, milk allergies will be there. So that has to be taken into account. Now, how to diagnose? Diagnosis of allergic disorder is often difficult because of the problems involved in a specific clinical disorder may vary. Many tests are being done to identify the allergen. A few allergens have been identified, and those can be tested in a specialized allergy clinic. Skin testing can be done, heme agglutination test, lymphocytic transformation test, immunoglobulin test, provocative test, etc. may be useful to identify the allergen which causes the problem. And how to manage this condition. Preventive measures. These include avoiding the offending allergen if this can be identified. Many factors which may aggravate basic allergic disorder, example, a cold weather or a smoky atmosphere may precipitate an attack of asthma, and by careful attention, this can be prevented. Then desensitization, specific anti-allergic inoculation or vaccination can be done. Specific desensitization is attempted wherever avoidance of specific allergen is not practicable. The usefulness of this is limited and is helpful only in atopic or very skin problem and allergic from insects. Drugs. In allopathy, they use adrenaline, antihistamine, aminophylline, and corticosteroids are some of the drugs which are effective in the treatment of allergic disorders. Now, a most important part in this allergic treatment is educating the child as well as their parents. Parental education should aim not only to elucidate the nature of the allergic state, but also to emphasize the importance of prophylaxis against exposure to allergen. Ayurvedic management. How to manage this condition in Ayurveda. It is individualistic, as everyone knows, because of the individual prakriti is different for each person. A general line of treatment may be planned and implemented. By identifying the doshas and dushyas involved in a particular condition, we can proceed on the Shastrokta procedures, Panchakarma procedures starting from Sneha Sveda followed by Shodhana Karmas may be planned according to the age and condition of the patient. General medicines which are useful in allergic conditions are Haridra Gandham, that is according to the age can be given either mixed with honey or hot water. Agastya Rasayana in appropriate doses can be given in conditions of respiratory problems, and Shida Jurari Kashayam can be given in appropriate doses where the skin allergies, etc. are there. Padola Kadurunyadi Kashayam also can be given in such condition. Then Chirishadya Arishtam, Khadirarishtam, Aragodarishtam may be useful in skin condition. Then cure-all medicine or a general medicine which can be given in such condition is Vilwadi Gudika, can be added according to the condition. oils like Eladi coconut oil, Nalpamradi coconut oil, Panchavalkadi Kodambu, Emberthyadi Keram, etc. can be used in skin condition. Then Rajanyadi Churna as a general remedy, it can be given, and Eladi Churna for external application will be useful. Then acute infectious, now after the allergy, let us consider a few acute infectious diseases. Infectious diseases occupy an important place in pediatric illness and pose problems in diagnosis and management, because children are more prone to get infections always, because when they go to the school from the classroom and while playing with other children, and because they are very close to and intimate to members of the family, they are prone to get acute infectious diseases. In this, the most important is fevers or pyrexia of undetermined origin. This is defined as fever over 38 degrees centigrade and 104 degrees Fahrenheit and lasting for more than 2 or 3 weeks duration. This is one of the common clinical problems in the tropics and subtropics. Diagnosis involves a thorough history taking and a well-conducted physical examination. Supported by appropriate laboratory tests. It is important to remember that most of the pyrexia or fever of unknown origin may be due to common illnesses with the typical manifestations rather than rare diseases. Then gram-negative septicemia. That is the main one of the main reasons of hyperpyrexia. This has come into prominence, especially in hospitals. This may occur with the children suffering from urinary tract infection, prolonged intravenous infusion therapy, resulting in thrombophlebitis, inflammation of the blood vessels, tracheostomy, and malignant diseases which produce profound leukopenia like blood cancer. The clinical signs of the child may appear pale, refuse to take food, and may progress to a serious condition and result in the death of the patient. An anaerobic infection. Many anaerobic infections also pose problem in the pediatric age group. Mixed infections often occur due to anaerobes. These organisms are resistant to antibiotics like penicillin and respond to chloramphenicol. Brain abscess, subphrenic abscess, empyema, thrombophlebitis of brain may be produced by anaerobic organisms, and they may produce endocarditis also. Viral infections. Nowadays, it is very common. Some of the viral infections present with a clear-cut profile. Example are mumps, chickenpox, etc. Laboratory aids are required only to differentiate conditions which bear close resemblance to each other. Recent studies all over the world have shown that most of the upper respiratory tract infections are of viral in origin. And in the laboratory, blood count, the total count and differential count examination of peripheral smear or malarial parasite, for malarial parasite or for microfilaria, and simple and will enable the clinician to find out if there is any leukocytosis, leukopenia, eosinophilia, or lymphocytosis, etc. Now, coming to the urine analysis. For routine examination, especially for pus cells, and culture and sensitivity should be carried out if facilities are available. Coming to the treatment side, it depends on an accurate diagnosis and appropriate drug therapy. As all of us know that viral diseases are difficult to be treated, and management of shock and other associated symptoms. Children with the contagious diseases should be isolated and protected from secondary infection. Once if there is one infection to a child, there is all possibility that he will be infected with a super infection. So that has to be taken care of, and they should be isolated and protected. Then from the Ayurvedic perspective, the sensation of heat experienced in various parts of the body, including the sense organs and mind, just as though one experience in anger can be treated as jwara. Dushta Sthanyavana and one's own wrongful deeds in Kala, Artha, and Karma, and foreign body reaction are said to vitiate the humors located in the Amashaya and displace the Koshtagni from there into the tissues, that is shakas, and other organs of the body. The thus displaced ama, along with the other humors, blocks the body channel and produces jwara. Amashayasto hatva agnim saamo margan pidayel vidadadi jwaram tasmal purvidalankaram. This is from Ashtanga Hridaya. Once the channels are opened up with the digestion of ama, the body humors assumes their prescribed position. There will be sweating, and there will be normal heat distribution all over the body, and the patient becomes all right. But if the ama still remains in the body, it again blocks the channel recurrently, and the diseases continues. The humors and ama, when get digested by langana and medication, the person gets cured of the disease. In pediatric practice, various factors like dentition or allergen, septicemia, and different types of infections like urinary tract infection, respiratory infection, digestive problems are important causes of fever. Graharogas mentioned in our text are mostly bacterial or viral infection, and for that matter, any systemic disease produce fever in children. The Purvarubas or prodromal symptoms of the beginning of jwara are mostly discoloration of the body, tiredness, dull feeling, yawning, burning sensation in the eyes, aversion towards food, and headache, body pain, joint pain, malaise, etc. Fever can be due to various causative factors like bacteria, viruses, fungus, or cancer. Many diseases show up with an initial symptom of fever. Fever is actually a protective mechanism of the body, while the body or our system reacts or fights with the causative factor. If the fever is not controlled properly, often identifying the reason, sometimes it may increase to such a level to cause convulsions, deliriums, or coma. When the fever affects the respiratory system, the symptoms are running nose, enlargement of the tonsil gland, ear inflammation, pneumonitis, cough, difficulty in breathing, etc. When it affects the lymph gland, there will be swelling of the tonsil gland, parotid gland, which can be diagnosed by examining the mouth and the throat and the nose. In this condition, gargling with salt water, application of tankanakshara with madhu on the inflamed gland, and kashayams like the Sumula Katatraya, Amrudotaram, along with the Kaishwara Gurgulu pill, Gorochanadi pill, Vettumaran pill will help. If the infection is in the ear, there will be inflammation and redness, and there can be discharge of pus or blood from the ear. In ear infection, advice should be given not to wash the head till the infection is controlled, and the cleaning of the ear carefully with cotton buds, and after that, dhupana with guggulu is effective. Medicines like Kaishwara Guggulu pill, Gorochanadi pill, and Karnapurana with Vachaleshunadi Thailam, Vajadi Thailam, or Chara Thailam will be of use. Ear wash with the water boiled with the Truphala, Yashti Madhu, Shiri Vriksha, etc. are also useful.
Ear has to be kept dry and cotton buds can be placed for protection. Urinary tract infection is another cause for fever in children. The nature of the fever will be mild fever with a shivering, and it will be intermittent. There will be low abdominal pain and swelling at the base of the eyes and on the dorsal, that is abdominal pain, swelling at the base of the eyes and the dorsum of the feet. There can be headache also. Generally, this affects the female children because they are shy, and maybe in the schools or classrooms, they will not be conveying to the teacher that they want to go to the washroom. So because they will be retaining the urine for quite long, and this can be a reason for urinary tract infection. A routine urine test will confirm the diagnosis. In this condition, Brihatyadi Kashaya, Punarnavadi Kashayam, along with the Chandra Prabha pill, Kaishwara Gulgulu pill, Yogaraj Gulgulu, then Gokshuradi Gulgulu, etc. And to control fever, pills like Gorajanadi, Vettumaran, Gokshuradi Gulgulu, etc. and Basmas like Pravala Basma, Shilajit Basma, etc. can be given. When the fever is due to some digestive problem, aristas like Mustarishtam, Pipalyasavam, Panchakolasavam, Ajamodarka, and Kashayas like Deshamula Kadutraya, Pajana Amradam, Amrdotaram, etc., along with Agni Kumara Rasa, Vilvadi Gudiga, Gorajanadi, Chukundi Palyadi, Govi Chandanadi, Vettumaran, etc., can be given. Ashtachurna will be a medicine, it's a powder of choice, and Hinguashtari Churna, Rajanyadi Churna with buttermilk or warm water will be useful to digest the ama. If vomiting is there, Gulardraga, Villuadileha, Villu and Madhivala Rasayana, etc., can be given. Jara has to be has 4 stages. As you know, that is the Amajara, that is the initial stages. The fever is high with all symptoms of Amatva and Kapha aggravation. The fever increases gradually. And the second stage is the Pachimana, that is when the doshas are under the process of digestion. Our Amapajana happen. There is continuous high fever with a delirium. The patient talks without connection and sometimes complains about vertigo. In this stage, the patient often passes stools also. And next comes after the Amapajana, the Pakwa Jara. It becomes Pakwa Jara. The fever gradually reduces and the patient feels lightness in the body. Then after that, he becomes Mukta Jara. The patient feels all right and appetite comes back, thirst, appetite, and all other physiological functions will start working. Now, coming to the treatment, in all cases of fever, one should try to find out the dosha dushti and dushya and then plan a course of treatment. There is a saying that if the physician is competent to treat a jwara, he is a good physician. That is actually what you call that a marker for a good physician, that if he knows how to treat jwara, he is a very good doctor. And fever itself is a big clinical problem, and the physician has to do the differential diagnosis carefully and provide the treatment. Fever is usually an accompaniment of some other disease like meningitis, TB, smallpox, chickenpox, enteric fever, etc. That is why most of the time when we suppress the fever, after some days it will come more vigorously, and with all its fury, it will be affecting the patient. Now let us consider some of the serious diseases which affects the children. So regarding Jara, I should not emphasize or describe more because Jara is only an initial symptom of many of the systemic problems. Now, some other serious diseases which affects children, among that more dangerous condition is meningitis. Thus is Mastishka Avarana Shodha. Infection of the central nervous system are frequently encountered in pediatric practice. Meningitis in the first month of life is not uncommon and is present in a quarter of cases of septicemia. Wherever when the patient is suffering from septicemia, it can easily affect the meninges and it can go to meningitis. Premature infants are especially prone because of their susceptibility to infection and increased permeability of their blood-brain barrier. Now, it is easy for them cross the blood-brain barrier and to affect the brain. Infection of the maternal genital tract. These are the main causes for meningitis. Infections of the maternal genital tract, birth trauma, prolonged labor after rupture of membrane may all be predisposing factors. How to diagnose this condition? The diagnosis is apt to be missed because the clinical picture is typical with meager symptoms. In the initial stages, it is very difficult to diagnose many meningitis, such as fever. The symptoms are very mild, just like a mild fever, poor activity, feeding difficulties, gray appearance of the body. Cyanosis, maybe the extremities will show more bluish color discoloration, or dyspnea, that is breathlessness, jaundice, vomiting, or fits. If it is more serious, the child will go to fits also. All non-specific findings, we cannot come to any conclusion, or we cannot arrive at a decision that it is due to meningitis. Even the fullness of anterior fontanelle, when you feel the anterior fontanelle, is not always very apparent, that there will not be any bulge or elevation of the anterior fontanelle. Mothers are frequently the source of the infection. Sometimes inflamed umbilicus of the baby can be the source. Mortality is very high, and serious neurological sequelae are common in the survivors. After the meningitis, there is a very high risk of the children. They go into common, the after effect will be more in children. Unless appropriate therapy is not instituted in the early stages. Escherichia coli are the most common organism. For the causative organism is Escherichia coli, and the most common organisms are Streptococcus, Staphylococcus comes next. Diagnosis that is possible only in hospitals or high specialized centers. Lumbar puncture and examination of CSF, cerebrospinal fluid, are indicated in suspected cases. Blood culture and sensitivity can be tested. Then nitro blue tetrasolium, that is NBT test. Then CT and MRI of the case of neurologic, if there's a case of neurological problem, then CT and MRI has to be taken. Polymerase chain reaction, PCR test, and CSF to diagnose specificity of the organism. And so many complications can be produced by this meningeal infection. Encephalomyelitis, ventriculitis, internal hydrocephalus, mental retardation, spinal cord compression, subdural empyema or effusion, mental retardation, and cognitive impairment, epilepsy, neurological problems, cerebral palsy, all these are complications of meningitis. So it is highly necessary that a pediatrician should be thoroughly informed about this condition, and the patient should not be put to test to avoid unwanted criticism. And in Ayurveda, we cannot find a description of a clinical condition which is similar to this, which correlates with the signs and symptoms of meningitis. Probably some of the symptoms shown by Mesha Graha Badha may be correlated with some of the symptoms of meningococcal meningitis or tubercular or viral meningitis, which produces fever with neck rigidity and spine arched backwards. There are jerky, convulsive movements of limbs. The child may vomit and become unconscious. The constitutional symptoms of fever, cough and loose motion, recurrent vomiting, excitability with the stiffness of the body, especially neck, leading to coma, are some of the points which can be compared with the symptoms of Mesha Graha Badha as meningitis. Treatment is highly dependent on the symptom. Some medicines worth trying are Deshamula Grada, Jaya Mangalarasa, Raja Mrigangarasa, Bruhat Vada Chintamani, and Kumbhajaji pills, etc. are worth trying. And we should not wait for too much of trial because the condition is very serious. That is regarding the infection of the meninges. Now coming to the upper respiratory tract infection. Acute bronchitis is a most important condition. Bronchitis, capillary bronchitis or interstitial pneumonia is a disease of the finer bronchioles and constitutes an emergency syndrome in pediatric practice. Usually there will be breathlessness and the child is brought to you in a very pathetic state. The disease is most common in cold months of the year and in infants, especially during the first 6 months. Acute bronchitis may result from a primary viral or a bronchial infection. Example, influenza. More often, acute bronchitis occurs secondary to infectious diseases like pertussis or measles, or some bacterial cause like congenital heart disease, and cause sinusitis, rickets, bronchial asthma may occur in the young initially as the bronchitis. Clinical picture. As a rule, constitutional disturbances are many. Cough is the most important symptom and may be dry, brassy, or harsh. Vomiting may occur from a violent bout of cough. Low-grade fever, chest pain, expectoration may all be present. Physical signs in the chest often reveal scattered rhonchi and rale over both intrascapular area, and audible wheeze may be heard in some cases. And a more serious condition after bronchitis, it may go to pneumonia. Pneumonia is common at all ages and occurs both in infants and older children. Clinical features, irrespective of the etiology, of the various types of pneumonia, they are all characterized by a sudden onset of elevation of temperature, that is from 102 degrees to 104 degrees Fahrenheit, and cough, dyspnea, that is both the ala of the nostril, they dilate with each breath. You can see that the nose will be blowing, that is, it will be enlarging, and tachypnea, that is increased respiration, 40 to 80 respiration per minute, tachycardia, more heartbeat, pain in the chest, grunting, lower intercostal recession, that the muscles of the intercostal region will be drawn inside, and distension of the abdomen, and abdomen will be distended, may all be present. Sometimes convulsions may occur. Rusty sputum may be observed only in older children. There may be vomiting, anorexia, and refusal of feed. Clinical examination will reveal the altered breath sounds typical of lobar bronchopneumonia. The WBC is often elevated. Ayurvedic view. In children, the pranavaha srodhas easily gets affected with the diseases as their agni is aniyada, that is due to ahara sangaratva and due to their weakness of dhatu excellence. Moreover, the site of pranavaha srodhas is at kavasthana, and children are more kapha predominant state. So mostly kapha diseases are encountered with the pranavaha srodhas in children. Nishtanna purasat atyushnam swasastasyo ubajayade, exhales hot breath from the chest, that is kapshirva samida shutrasthana. In children, Shwasaroga can occur by preceding conditions like untreatable kasa, gastrointestinal tract infection, amadisara, aspiration of vomiters, that is vamadu, regurgitation is a useful cause of aspiration. Aspiration of vomiters, that is vamadu regurgitation, the vomited material, sometimes it may go into the trachea and into the lungs, is a usual cause of aspiration. Toxic or anaphylactic, that is visha, can also be a cause of the problem. Hemolytic disorders in infants, that is pandu, or with chronic anemia. Pulmonary diseases, that is jwara or allergic factors, rejo, duma, anilai, himambuna, kasapradya bhavet shwasa, purverva doshapovanehi, amadisara, vamadu, visha, pandu, jware ravi, rejo, duma, anilai, marmakhadat, adi, himambuna. Ashtanga de Nidana. Bronchial asthma in childhood is defined as the hyper responsiveness of trachea. It is a what you call that, something like an allergic reaction. Bronchial smooth muscles to a variety of stimuli, resulting in partially or completely reversible narrowing of the tracheobronchial tree, often accompanied by increased secretions and mucosal edema, presenting clinically as paroxysmal dyspnea accompanied by wheezing. Samprapti. Kapha uparuddhagamana pavano vishwagastita, that is prano udaga annavahini dushta srodamchi doshen mudasta kurade shasam amashaya samudbhavam. So in Ashtanga Dhyaya, it has been mentioned that it is the cause is mainly Kavaja, and Shwasa originates in Amashya, but the manifestations are seen in the Uras. Vada gets obstructed in by Kapha, remains static in previous direction. It will be blocking the Shwasapatha and vitiates the prana, udaga, and annavaya srodhas, resulting in Shwasaroga. Treatment is, since Panchakarma Shodhana like Vamana are difficult to be performed in children, Samana Aushadha Prayoga is more effective. Arishtas like Vashagadya Arishta, Kanagasava, Tripalyasava, Chiragadya Arishta, and kashayams like Dasamola Kadatraya, Belajiragadi, Indukandam, Churnams like Talisabatradi, Vyoshadi, Harpuradi, Gudigas like Vayu Gudiga, Swasananda Gudiga, Swasa Kutara, and Chukuntipilyadi Gudiga, and Basmas like Abraga Basma, Tamra Basma, Lehyas like Agasti Rasayana, Kushmanda Rasayana, Ajamamsa Rasayana, Desamul Rasayana are found to be effective. Now coming to some infectious diseases which are modern. Dengue fever. Dengue fever occurs sporadically in coastal areas, occurring in intervals of years, attacking large sectors of the population, but it is not common in children. The virus, which is transmitted by the Aedes aegypti, is infective to the other mosquito, which infects man 2 weeks later and remains there till it dies. Clinical features. The incubation period is from 5 to 9 days. The onset is sudden with a headache, rigor, high fever, severe backache, and joint pain, which persists throughout the course of the illness, giving it the name of breakbone fever, because such a excruciating pain in the bones will be felt. There is supraorbital pain around the eyes, and mouth and eyes are infected. The face and extremities appear flushed. The fever comes by crisis on the 5th day and remain normal for 2-3 days. But a secondary rise for a day or two occurs. That is just like a saddle sitting on the on a horse, just like saddling. It will be just like a jumping. The fever will be jumping with increased joint pain and appearance of a characteristic rash. Forms first on the hand, then extending to the whole body and fading away in 2 or 3 days. Bradycardia, not marked in children, and leukopenia occur. The diagnosis is difficult because before the appearance of the rash, the virus is isolated from the blood during acute stage of the disease. Treatment is symptomatic and supportive. Analgesics are required for pain and discomfort. Complications such as hemorrhages and shock may require sometimes may require blood replacement. And the complications are asthenia and joint pain. Muscle pain and joint pain may continue for weeks. And many patients have complained of knee or ankle joint may persist for months, causing difficulty. Ayurvedic medicines like Guduchadi Kwada, Vetamaran pills, Vilyadi Gudiga, Padola Kaduronia Kashaya, Amrdarishtam, Pipalyasvam, Gorodhanadi pill, Sudarshana Ganavadi are effective in this condition. Now, another new era disease is chikungunya, an epidemic resembling hemorrhagic fever, starting with convulsions in the infants and young children, and fetal deaths were reported in pregnant women. Joint sequelae were common, involving wrist, ankle, knee joint. The disease was reported to be due to chikungunya virus transmitted by Aedes aegypti. It mostly bites during daytime. And treatment is symptomatic, almost on the same line of dengue fever. Now, a very important fever is typhoid. The incidence of typhoid fever is universal. In the tropical areas, however, it is endemic in many places due to low standard of living, unprotected water supply, and unhygienic methods in preparation and handling of food. The disease is transmitted through the oral route from contaminated drinking water, milk or other food, ice cream, contaminated vegetables, etc. The source of infection are patients suffering from the disease or from excreta of carrying fomites, that is just like handkerchiefs or any towels or dress what the patients are using may be a cause for the infection to others, may also play a role in the spread of the disease. The housefly helps in disseminating the infection. About 20 to 30% of typhoid fever cases occur in children below 10 years. It is rare in infants because they are usually breast, very small infants, it is very rare because mostly they are breastfed. The pathology of the disease, the organisms are gram-negative, known spore-forming bacilli, Salmonella typhi and Salmonella paratyphi, A, B, or C. They make entry into the bloodstream through the intestinal lymphoid tissue and infect liver and spleen. They also multiply rapidly in these organs and reinfect the blood and the alimentary canal. The Peyer's patches, especially we can see on the tongue, get swollen, they necrose, and later form ulcers, which may potentially lead to hemorrhage, and sometimes intestinal perforation also may happen. The spleen and mesenteric gland are enlarged. The toxins released by the destruction of the bacilli cause toxemia and involvement of many vital organs. Clinical features. The incubation period is usually between 8 to 21 days. And in majority of the cases, the onset is sudden with a headache, malaise, and low fever. And especially in infants and young children, it may be abrupt with chills, high fever, convulsion, resembling meningitis, or it may stimulate acute bacillary dysentery with vomiting and diarrhea, or an acute respiratory infection with cough and bronchitis. The spleen is enlarged, and there may be a slightly enlarged liver, which is soft in consistency. The abdomen is moderately distended, and diarrhea or constipation may be present. The temperature gradually increases in a step ladder pattern, just like climbing up the ladder. The nature of the fever will be like that. And the evening temperature is higher than the morning. Diagnosis, how to diagnose the typhoid condition. Isolating the organism, blood or from blood or bone marrow culture may be positive in 90% of the cases in the first week. Urine and stool culture generally becomes positive during the third week. Serological test, or generally we call Vidal test, may be positive by the end of the first week. Blood smear, that is a leukopenia with relative monocytosis. Absence of eosinophils has some diagnostic value. Eosinophil count will be very less in this condition. Elevated ESR and CRP also will be positive. Treatment. Administration of Jara medicines, especially Indugandha Kashaya. Indugandha, it is mentioned that Nimnonad Jarahara. So when there is a step ladder type or fluctuating type of Jara in typhoid, Indugandha is very effective. And the Deshamolaka Kashaya, then Amrita Arishtam, Pipalyasavam, Mustarishtam, Parpadagati Arishtam, and Vishamad Jurandhaga pills. It's a special pill which mostly we use in Kerala. Gorajnaji pill, Sudarshana Ganavadi, Agni Kumara Rasa. These are all medicines which can be used in the treatment of typhoid. Now, another serious condition in children is diarrhea. Diarrheal diseases in infancy still constitute one of the chief problems in pediatric practice. The situation with regard to infantile gastroenteritis is even at present depressing. Diarrhea is probably still the commonest cause of infant mortality in most tropical and subtropical countries. Newborn, young infants, and malnourished children, because of their immature immunological response, are particularly susceptible, especially if they are not breastfed. Moreover, they are especially prone to dehydration and electrolyte imbalance, which usually accompany the condition. Water is lost in enormous amounts in the frequent liquid stools of acute diarrhea caused by hyperperistalsis. Along with it, electrolytes, especially sodium, that is Na, potassium, K, and bicarbonate, HCO3, are lost. When the condition is accompanied by copious vomiting, further loss of fluid, as well as chloride, and a little bit of potassium present in the gastric content take place. In infants, the kidneys are immature and unable to concentrate urine and conserve water for the body to the same extent as adults do during such periods of stress. Insensible loss of fluid through the skin and lungs, aggravated by fever, high environmental temperature, and that is a excessive breathing of acidosis also added to the fluid deficit. The infant is unable to replace the losses because, unlike the adults, he cannot reach for water. Anorexia, as that is the loss of appetite, as well as vomiting, when present, may also prevent effective oral intake of fluid. Besides the assimilatory mechanism of the intestine, it is impaired in diarrhea, precluding the normal absorption of nutrients. The events tend to produce firstly dehydration or reduction in the fluid volume of the body. The blood plasma is the first to feel the fluid loss, but this is promptly replaced by interstitial fluid. But if the process is rapid and continued, the compensatory mechanism fails. There is marked reduction in the interstitial fluid volume, followed by concentration of plasma volume. The blood pressure falls, leading to peripheral stasis and cellular anoxia, with the accumulation of products of incomplete carbohydrate mechanism. Finally, shock, characterized by skin cold extremities and rapid thready pulse, may supervene. Clinical appraisal of the dehydration consists of noting the extent of loss of weight loss well below 5% is mild dehydration. Between 5 to 10% can be considered as moderate, and above 10% indicates severe dehydration. The skin turbidity or turgor of the skin, condition of the eyes, and mucous membrane of the mouth, the character of the pulse, urine output, and the state of the anterior continent will be vital. It is characteristic clinically by irritability, occasional shrieking cry, excessive thirst, a dry parched tongue, and a duffy feel of subcutaneous tissues. Delirium, convulsions, and coma may occur, and the brain damage that sometimes ensues may become irreversible. Ayurvedic view, Adhisarana, Adhisara. The explanation of Adhisara is given like Adhisaranat Adhisara, because excessive saratva of fecal matter. And Atyanta Saranat Adhisara, that is Sushruta has in Nidana, he has told that Atyanta Saranat Adhisara. The etiology or Deha Vaivaranyam Aradi Mugaglani Anidrada Vadakarma Nivrti Tetyate Adhisara Ugravedana. That is discoloration of the body, uneasiness in the mouth, that is distaste, and fatigue, insomnia, absence of functions of Vayu. Adhisara is a very common disease met in pediatric practice. The excessive sarana of Purisha Yukta Abdadu through Adhomarga is termed as Adhisara. Nidana. Adhisara Sudaram Jayade Atyambu Manada Krisha Shushka Amisha Asatnya Tilabishta Virudhagehi Madhya Jusha Adimatra Anna Arshobi Sneha Vibhrama Krimibhyo Vega Rodhascha Ashangrade Nidana. The main cause of Adhisara is Vayu Vriddhi, and factors contributing to this are dietary factors, as we have seen earlier, and diseases produced by krimi, cholera, dysentery, etc. Psychological, that is stress, fear, etc. And Tanya Dushti, Grahabhata. Then without unknown origin, that is iatrogenic, like a tropical sprue. Diarrhea contributes 15 to 40% of deaths in the age group of less than 5 years. In India, at least 1.5 million children under the age group of under the age of 5 die due to acute diarrhea every day. Treatment: the basic treatment of Adhisara is same as that of adults. First assessment should be whether the condition is with AMA or Nirama. But too much of a Lankana therapy is not advisable. Even if AMA is associated with Adhisara, in Ashtanga Sangraha treatment of the pathological gastrocolic reflex is well mentioned. Pidam cha yas tanyam sa vadam adhisaryade tasya apyedat param patyam divanam balavarnakar. The children, in children, the assessment of dehydration is very difficult. Treatment should be carried out assuming that the children with watery diarrhea will have dehydration. Management: that correction of dehydration and restoration of fluid and electrolyte balance. Then with medicine, dietetic management, treatment of complications. And these are a few important diseases which I have prepared for this session. And all the diseases which are affecting the elderly people can affect the children. In addition to there are specialized diseases like Pakaroga, Graharoga, and many conditions which are special to the children. That is poliomyelitis. Such conditions are especially special for the children. Such a condition, if we go to the entire lot of diseases, it may not be possible to conclude within this one session. Each disease may take one session of the webinar. So with this few rogas, I would like to close the this discussion. And now I am open to for a discussion regarding these diseases which I have described. Thank you.
Thank you very much, sir, for taking your time to prepare for us such an extraordinary, wonderful presentation, which was incredibly informative. We will now go ahead to the question and answer session. Shall we begin, sir?
Yes.
Okay, sir.
In allopathic treatment, I am not an expert, so we cannot go into the very technical part of it. So only Ayurvedic side, I will be more comfortable with the Ayurvedic side.
Sure, sir. Sir, can I ask?
Yeah.
Sir, the first question. In the West, we see a lot of babies with occult blood and mucus in their stools. We think it's a milk protein intolerance and tell breastfeeding moms to eliminate dairy from their diet. Any thought from an Ayurvedic standpoint, the baby is still having mucus in their stools?
Beg your pardon, it is not clear to me. Can you repeat?
Yes, sir. In the West, we see a lot of babies with occult blood and mucus in their stools.
Okay.
We think it's a milk protein intolerance and
Yeah.
tell breastfeeding moms to eliminate dairy from their diet.
Okay.
And any thought from an Ayurvedic standpoint if the baby is still having mucus in their stools?
That may not be a reason for this blood and mucus in the this blood of the baby. If at all there is any stanyadushti for the mother, or if the mother is taking too much of dairy products, it is very less chance for the baby to get affected with that, and maybe it may be either this amoebic dysentery, or maybe the stricture, or any abrasions in the intestine that can cause this blood and mucus in the stools. May not be because of this mothers taking dairy products. And lactose intolerance generally, if it is very chronic, in such cases when the buccal mucosa, that is the mucosa of the intestine, when it gets abraded, there can be this mucus and blood. This usually happens in amoebic dysentery or rectadisara. So for that, this mothers has to be treated with Kodajarishta or Vilvadi pills, and they are for Sanya Shuddhi, we can give medicines for that.
Thank you, sir. Next question. Best Ayurvedic medicine to reduce allergy. From your experience, please share, sir, please.
I have already mentioned in the allergies section that it depends on what type of allergy is that. In generally, we used to give Haridra Ganda or Agastya Rasayana, or there's in proprietary medicines. You will find a lot of tablets like allergen, nasoallerine. So many proprietary medicines are in the market. And generally in Ayurveda, to a system corrective medicine, we used to give Agastya Rasayana and Haridra Ganda. Rajanyadi Churna can be given. These are the medicines of choice in this allergic conditions of the children. General, I am telling, and it is specific to particular allergens. Actually, if it is a breathing problem, you have to add bronchodilating medicines, like, as I have mentioned, like Vasarishta or Pipalyasava, Abragvasma. This can be added to this. Or if it is due to some food allergy, then you have to look into that. What food causes the problem, and it is better to avoid such food. The allergens can be avoided. And general the medicines are these Haridra. Mainly Haridra is one of the best medicine, and nowadays aloe vera is being used as an antioxidant and a good medicine for all types of allergies. So that will help the condition.
Thank you, sir. Next question. Ayurvedic medicine useful for abdominal colic pain in 5-6 month baby.
5-6 months.
Yes, yes,
5,
yes,
6
sir.
months, say, how do you diagnose the condition of abdominal pain? Usually, the baby will be crying and he will be touching the this part which is uncomfortable for him, especially the stomach will be bloated, and it can be due to gas, trapped gas inside the intestine. So that is after each feed, he has to be put on the shoulder, and mild patting on the back of the child will help to release the trapped gases, and this will help to remove the colic. And in such condition, we used to give Acorus calamus, that is the Vayamba, if it is just a rub with a little bit of honey, and that can be put on the tongue of the baby, because it is only 5, 6 months. You cannot give very high doses of medicine. And in this, you can give maybe a little bit of ginger juice with honey. It can be mixed, and it can be given. And if it is due to some indigestion, then you have to look into the this indigestion part, and medicines like Ashtachurna, Ingu Ashtachurna, or maybe Pipalyasava or Mustarishta can be given. And this will help to relieve the problem. And Panchakolasava is very effective in condition, and Ayamodaga, if it is boiled with water, and such boiled, if you 1 or 2 teaspoons, if it is 5, 6 months, I'm telling, and if it is very small baby, then you have to give it in drops. 5 to 10 drops can be given 2 or 3 times. This will help to relieve the pain.
Thank you, sir. Next question. How to manage hiccups in a 2-year-old child?
Hiccups.
Yes, sir.
Hello? Hiccups.
Yes,
Yeah, so that is not a very serious problem. It is not a, is it a chronic problem? Then you have to look into that. It is mostly due to pranavas, that is pranadushti, and it is not a very good sign. So that has to be looked into, and decoctions like this, Balaji Ragadi Kashaya can be given, which to alleviate the Vada aggravation, and maybe Jiragarishta will help. And if it is only 3 or 4 months, it is not a very good sign. You have to refer to a appropriate, and if it is continuous and long lasting. If it is a temporary phenomenon, usually the cause will be, as I told you, maybe trapped gases. For that, you have to, as I told you, to release the gases, just tapping on the back of the baby, putting the baby on the shoulder will help to release the trapped gases. And in the market, you can try with Himalayas Bonisan is there, which is a very good carminative, as well as an antacid, which will also a digestive medicine. It is, you cannot consider it is just like a gripe water. This can be given, or maybe omam. You can just boil with water. This a few drops you can give, or Jiraga is the best medicine. Bella Jiragadi Kashaya and Nayobaya Kashaya in very small quantity. After diluting with water, you can give in 1 or 2 teaspoons with either Shwasananda pill or Vayu Gulika. You can add in one, this, maybe in, after diluting, you take 25 ml of Kashaya, and in that 1 Shwasananda pill or this Vayu Gulika, 1 Vayu Gulika has to be dissolved. This has to be given to interval. This will help to relieve the condition.
Thank you, sir.
Any other questions?
Sir,
Yeah.
can you hear, sir?
Yeah, yeah.
Can I repeat the question?
Yeah, I have not heard any question. But
I'm sorry. Okay, sir.
after Hika, I have not heard anything.
Okay, sir. I'll read. Could Langana be given as a start treatment of Jwara for children and from what age group, sir?
See, actually, because of the Tarunata of the Bala, it is not advised to give a very severe Langana in small children. You can give with this sort of light food, just like kanji, or if it is still more, this baby is still smaller baby, you can give kanji water, can be given, and or hot water with maybe boiled with this omam, or with the panchakola, you can boil water, and that can be given in very small quantities. And this will help to digest the ama. This will help to digest the ama. And Ashtachurna is the medicine of choice in all digestive disturbances in children. Hingu Ashtachurna or Ashtachurna can be just mixed with honey, and this can be put on the tongue of the child, and that will help to digest the ama, and then it will clear the amatva. And Lankana, in generally, you can give a hasta sweda or pada sweda or something like that. It can be given to help the condition that will improve the temperature of the body and help to digest the ama. Lankana, generally, with the light food you have to do. You should not completely avoid giving food to the babies, because they are easily affected. Without food, they cannot survive without food for long. So that will, with a lesser quantity and with a lighter food. Maybe if he is very particular about milk, milk has to be diluted, and that can be given. Okay.
Okay, sir. Thank you, sir. Next, sir, we are concluding with our last question. Our last question is, should Asavarishta and other medicine be administered in Kshirat and in Kshiranath? How should these drugs be given, sir?
For only Chirapa, you can, it is better to avoid aristas just after feeding the baby, because milk sometimes it may curdle. That is, it may, what do you call that? It may become curd if arista, because it is slightly sour in taste. Just after feeding the baby, if you give aristas, it may cause digestive problems in the children. So after maybe after feeding, you have to wait till half an hour or 45 minutes. After that, aristas can be given. And that too, aristas diluted with boiled water can be given in small babies. That is because of that spirituous nature. That is because self-fermented alcohol is there in aristas. There are all chances or possibility that the child may draw it into his trachea, and then it will become a very serious problem. So it is better to dilute arista, or even this you can make it warm, and that can be given with appropriate pills or other medicines. Kashaya can be added. It is always better to give this, add something like honey, or maybe sugar candy can be, that is kalkanda, can be added with kashayas. And all medicines for children, for that matter, should be very soft, pleasing, and it should be good smelling with a good color. And so you have to think about it, and as the child likes, you have to make the changes according to his style of or his liking. You have to prepare. And aristas, as such, you should, it is better not to give to the children, you have to dilute it, or you have to add boiled water and dilute it, or with kasha you can dilute. Then it can be added with honey or sugar candy, and it can be given.
Thank you, sir. Sir, we have one more question. The question is Ayurvedic management of worm infestation.
Yes. Ayurvedic management, in generally we this krimi roga, it is mentioned that different types of krimis are likely to affect the children, and it, in such conditions generally hingu is the medicine of choice in such conditions, and vidalari or vidanga is also mentioned to avoid worm infestation. So Vidangarishta can be available. Recently somebody was inquiring where it is available. Vidangarishta, some of the pharmacies, they are preparing Vidangarishta, and this can be given. Or that Vidanga Kwada also will be available. Or you can give Ashtachurna. With the honey, it can be diluted and it can be given on routine basis. Every day you can give, which will avoid worm infestation in children. And generally, hygienic sanitary methods or toileting is very important. And this, while before taking food and all, washing their hands, they should be practiced to do washing of their hands, and this, brushing their teeth. All this we have to train them, and if that is done properly, and if at all the medicine is if there is a problem of a krimi roga in any one of the children of the family, I think it is better to give the medicine to the whole group of children in the family. And you have to this even this stool test can be done for other members of the family, and what type of it depends. The treatment usually depends on the type of the worm. According to allopathic system, they give piperacetin citrate is given, and pyranthal palmoate is given. Such a medicine, according to the type of the worm, you have to select the medicine. And generally speaking, this Ashtachurna is very good, and this Vidangadi Kwada is very useful, or Vidangarishta can be given. Such medicines are effective.
Thank you very much, sir. Now, I invite Mr. Vairamuthu K, final year student, Ayurveda College, Coimbatore, to deliver the vote of thanks.
Namaste to one and all. Namaste, sir.
Namaste.
It is my privilege and be honored to propose a vote of thanks on behalf of this great occasion. अस्माकं आयुर्वेदस्य प्रतिरूपः कुमारस्य रक्षकः स्वमनसि अपि ज्येष्ठः महाविद्यालयस्य महान् अस्माकं महाविद्यालयस्य महान् हृदये अष्टाङ्गहृदयं तस्य चरणे चरकसंहिता तस्य क्रियायां शुश्रुता अष्टाङ्गसङ्ग्रहं च इति सर्वस्य सङ्ग्रहः अस्ति महोदयः। आयुर्वेद अध्ययनकालः सः तत्रापि विशिष्य स्वाध्यायसङ्ग्रहणकालः सः तस्य कारणभूतः अस्माकं प्रियमहोदयः। शिष्योपनीयनीयतः प्रतिज्ञापरम् अपि विवेकं कर्तुं न शक्तवन्तः वयम्। आम्, वयं विवेकं कर्तुं न शक्तवन्तः। महोदयः तु अस्माकं पितुः वा प्राचार्यः वा इति विवेकं कर्तुं न शक्तवन्तः। महोदयः वयं सर्वे अपि मैत्री कारुण्यम् आर्तेषु परिपालनीयम् इति पाठयितवान् अस्ति, किन्तु महोदयः मैत्री कारुण्यं छात्रेषु अपि परिपालितवन्तः। आयुर्वेद विकासनाय विशेषेण कुमारस्य सुरक्षणाय छात्राणां विपठिषवर्धनाय सहप्रवर्तकाणां हिताय संस्कृत अनुरागिणः महोदयः स्वस्य मार्गदर्शनेन आदर्श जीवनेन अपि अस्मान् प्रेरयन्ति पाठयन्ति च महोदयः इतोपि वक्तुम् अहम् इच्छामि परन्तु समयस्य समस्या कारणेन एवम् उक्त्वा अहं समापयामि शास्त्रं रक्षति रक्षता उत्तम उदाहरणम् अस्माकं प्रिय हित चाको महोदयः ओम श्री गुरुभ्यो नमः and I feel honored and to express my vote of thanks to this wonderful occasion and the team Samsiddhi and the platform powered by DIKSHA e-learning and thank you one and all. Namaste.
Thank you very much. Thank you for the entire team of DIKSHA and Ayurveda College teachers for giving me a chance to at least discuss with our students some of the this, because last year mostly the comorbidity classes were very less, and I think this may give some insight for the students also. When they are ensuing exam, they will be able to fare better, perform better with the small information what we have discussed today. And I thank Dr. Sudhir and all other staff members. Thank you.
Thank you, sir. Now, I cordially invite Dr. Sudhir Raj N, Principal, Ayurveda College, Coimbatore, to conclude the session.
Thank you very much, Chako sir, for sharing valuable experience about the common Balaroga and its clinical management. It was an excellent session, even though the topic was very vast. Sir explained almost all the common conditions which we come across in a clinic and very elaborately explained the symptomatology of each diseases with its modern and Ayurvedic view and its Ayurvedic management. From the bottom of my heart, on behalf of the whole Samsiddhi team, I thank once again for taking time and sharing your valuable experience, sir. Thank you all the participants from India and abroad who had joined with us today, and I thank DIKSHA e-learning for powering the program. Thank you all once again. Actually, for Chako sir, we don't have to say thank you because he is from our family only. So actually, it is a custom. That's why I told thank you to sir. Otherwise, sir will not expect that also because he is from our family. Thank you very much, sir.
Exactly correct. Thank you.
Thank you. Thank you.
Thank you, sir. The influence of a good teacher can never be erased. Thank you, sir, for influencing us each day. We have come to an end of today's session. Dear delegates, the session on 12th day of Samsiddhi 2020 will be conducted on 7th August by Dr. A.A.N. Uday Kumar on the topic My Journey on Treating Autism and by Dr. T. Girish Krishnan on the topic Neurodegenerative Diseases, a Practical Approach Through Rasaushadhis. To know more about our updates, please do stay connected with our social platform. That's all for today's most interesting session with lot of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining us. Thank you. A very good night to you all.
Thank you. Seri sir.
Okay, bye. Thank you.